A 52-year-old patient diagnosed with peptic ulcers is discussing lifestyle factors with the nurse. Which of the following are recognized risk factors for peptic ulcers? Select all that apply. A. Helicobacter pylori infection. B. Excessive smoking. C. Alcohol ingestion. D. Frequent exercise. E. Caffeinated beverages. Correct answers: A, B, C, and E. Helicobacter pylori infection is the most common cause. Smoking, alcohol, and caffeine increase acid secretion and aggravate ulcers. Frequent exercise is not a risk factor. A patient presents with burning epigastric pain, nausea, and vomiting. The nurse reviews the patient's history to identify contributing factors. Which should be considered? Select all that apply. A. High-fiber diet. B. Severe stress or sepsis. C. Familial history of ulcers. D. Use of non-steroidal anti-inflammatory drugs. E. Blood group O. Correct answers: B, C, D, and E. Non-steroidal anti-inflammatory drugs irritate the gastric mucosa. Stress ulcerations occur under severe physiological stress. Familial predisposition and blood group O are associated risk factors. High-fiber diet is not related. Number 3. The nurse is preparing patient education for someone newly diagnosed with peptic ulcer disease. What points should be included? Select all that apply. A. Avoid alcohol and smoking. B. Follow a bland diet, avoiding spicy and acidic foods. C. Increase caffeinated beverages to aid digestion. D. Take prescribed medications consistently. E. Manage stress through lifestyle changes. Correct answers: A, B, D, and E. Avoiding irritants such as alcohol, smoking, spicy foods, adherence to medication, and stress reduction promote healing. Caffeine increases acid secretion and should be avoided.
A patient with peptic ulcer disease is prescribed antacids, H2 receptor blockers, and antibiotics. Which statements accurately describe these medications? Select all that apply. A. Antacids neutralize stomach acid. B. H2 receptor blockers block histamine to reduce acid secretion. C. Antibiotics eradicate Helicobacter pylori infection. D. Antacids kill H. pylori bacteria. E. Antibiotics prevent acid secretion. Correct answers: A, B, and C. Antacids neutralize acid. H2 blockers reduce acid secretion. Antibiotics kill H. pylori infection. Antacids do not eradicate bacteria, and antibiotics do not directly affect acid secretion. A patient scheduled for pyloroplasty asks about surgical options for peptic ulcer complications. Which information should the nurse include? Select all that apply. A. Pyloroplasty widens the pyloric valve to relieve obstruction. B. Vagotomy decreases acid secretion by cutting vagus nerves. C. Billroth 1 involves removing the small intestine. D. Gastric resection removes the distal part of the stomach. E. Billroth 2 connects the stomach to the jejunum. Correct answers: A, B, D, and E. Pyloroplasty widens the valve. Vagotomy blocks acid secretion. Billroth 1 removes the part of the stomach connecting to the duodenum. Billroth 2 connects the stomach to the jejunum. A patient is admitted with a suspected perforated peptic ulcer. What clinical findings are consistent with this diagnosis? Select all that apply. A. Sudden severe abdominal pain. B. Rigid board-like abdomen. C. Black tarry stools. D. Mild epigastric discomfort. E. Fever and signs of peritonitis. Correct answers: A, B, and E. Perforation causes acute severe pain, rigid abdomen from peritonitis, fever from inflammation. Black stools suggest bleeding. Mild discomfort is less likely with perforation. Postoperative care for a patient after ulcer surgery includes which nursing actions? Select all that apply. A. Encouraging high-fat, spicy diet post-op. B. Frequently manipulating the NG tube for comfort. C. Positioning unconscious patients in SIMS position. D. Ensuring return of bowel sounds before starting oral intake. E. Monitoring NG tube aspirate for signs of bleeding. Correct answers are C, D, and E. Monitoring aspirate detects hemorrhage. Avoid manipulating NG tube to prevent injury. SIMS position reduces aspiration risk. Bowel sounds indicate GI readiness. High-fat, spicy foods are contraindicated. A nurse is assessing a patient with peptic ulcers for signs of complications. Which are potential complications? Select all that apply. A. Hemorrhage. B. Perforation. C. Penetration of ulcer into other organs. D. Pyloric obstruction. E. Weight gain. Correct answers are A, B, C, and D. Hemorrhage, perforation, penetration, and pyloric obstruction are known complications. What are clinical manifestations suggestive of complicated peptic ulcer disease? Select all that apply. A. Hematemesis. B. Sudden severe abdominal pain. C. Weight loss and anorexia. D. Constipation and abdominal distension. E. Increased thirst and urination. Correct answers are A, B, C, and D. Bleeding, hematemesis, perforation, severe pain, malnutrition, weight loss and anorexia, and obstruction symptoms, constipation, distension, occur. A nurse is caring for a patient with peptic ulcer and plans to provide dietary instructions. Which foods and habits should the nurse advise the patient to avoid? Select all that apply. A. Spicy and acidic foods. B. Alcohol and tobacco. C. High-fiber fruits and vegetables. D. Excess caffeine. E. Large, heavy meals before bedtime. Correct answers are A, B, D, and E. These increase acid secretion or irritate mucosa. Fiber is generally not contraindicated. Great job making it to the end of Part 1 of Peptic Ulcer Select All That Apply NCLEX Questions and Answers. How many questions did you get correctly? Drop your score in the comment section below. I'd love to see how you did. In the next video, we'll cover the Part 2 of Peptic Ulcer, Select All That Apply, NCLEX Questions and Answers with rationale. So make sure to subscribe and turn on the bell notification to get notified when we drop the next video.